Have you ever left a doctor's appointment feeling more confused or anxious than when you walked in? You're not alone. Many older adults are told they need test after test, year after year, but what if some of those checkups were doing more harm than good? After 70, your body changes, and so should your health care. While regular health checkups are important, not all tests are necessary at this stage in life. In fact, some screenings may cause more stress, unnecessary procedures, or even physical harm. Without offering real benefits in today's video, we're breaking down 5 health checkups seniors should think twice about after age 70 and why a more personalized, thoughtful approach may be the best medicine. 1. Colon cancer screening after 75. Colonoscopy is one of the most recommended tests for adults over 50, but did you know the U.S. Preventive Services Task Force recommends against routine colon cancer screening after age 75, especially if you're in generally good health, with no major risk factors? Why? Because after a certain age, the risks of the test itself, sedation complications, bowel perforation, bleeding, can outweigh the benefits. Plus, colon cancer typically grows very slowly. If you're 75 or older with a clean history, the likelihood that this test will save your life is very low. If your doctor still suggests it, ask, will this test change how we treat anything at my age? If the answer is no, it might be time to pass. To PSA test for prostate cancer for older men. The PSA blood test, which checks for prostate-specific antigen, can seem routine. But here's the problem. The test can pick up slow-growing prostate cancers that may never cause symptoms or impact lifespan. Yet once detected, many men are rushed into aggressive treatments, including surgery or radiation, that come with life-altering side effects like incontinence and erectile dysfunction. For men over 70, most medical guidelines say the PSA test should be used only if there are symptoms or if you and your doctor agree it's truly necessary. Otherwise, it may only cause anxiety and cascade into unnecessary interventions. 3. Mammograms after 75. Breast cancer screening can be life-saving, but after age 75, it gets more complicated. Many studies now show that for older women in good health, routine mammograms might not offer meaningful benefits, especially if life expectancy is under 10 years. Why? Because mammograms can pick up slow-growing or non-threatening tumors that may never spread, leading to overdiagnosis, overtreatment, and even emotional trauma. Surgery, radiation, or hormone therapies can be physically and emotionally draining. Talk to your provider about your individual risks, family history, and personal values. If a mammogram won't change your course of care, it may be better to skip it. For bone density test. If you've never had a fracture, osteoporosis is a major concern as we age, but after 70, bone density tests, DEXA scans aren't always necessary. Especially if you've never had a fracture, aren't on medications that weaken bones, and have no other risk factors. Why does this test get overused? Because it sounds helpful, but in low-risk seniors, it often leads to unneeded prescriptions for bone medications like bisphosphonates, which can cause jaw issues, digestive problems, and even rare fractures over time. Instead, doctors can assess fracture risk using simple questions about falls, weight, strength, and history. Focus on fall prevention, strength training, calcium-rich foods, and vitamin D. These have a far bigger impact than numbers on a scan. 5. Annual full-body scan. Some private clinics market full-body MRIs or CT scans as cutting-edge ways to catch cancer early. They often sound appealing, especially to older adults who want peace of mind. But here's the truth: there's no solid medical evidence that full-body scans in healthy people without symptoms actually save lives. What they do often cause is something called a false positive, detecting small, harmless abnormalities that spiral into anxiety, more tests, biopsies, or even surgeries for things that never needed treatment. Full-body scans also expose you to unnecessary radiation and can cost thousands out of pocket. Unless your doctor recommends a scan for a specific concern, skip the hype.